Pemphigus vulgaris is an autoimmune disease. Look at this picture shows that skin erosions and blisters. Laboratory test findings. Look at this. A detail going on. Introduction. Pemphigus vulgaris is a rare chronic autoimmune disease characterized by blistering and erosion of the skin and mucous membranes. It occurs due to the production of autoantibodies against proteins critical for cell adhesion in the epidermis. If left untreated, it can lead to severe complications and even death. But with early diagnosis and effective management, the prognosis has improved significantly. A definition: Pemphigus vulgaris is defined as an autoimmune disorder in which antibodies target dysmogulins proteins essential for cell to cell adhesion in the epidermis. This results in the loss of cohesion between keratinocytes, leading to intraepidermal blisters. Types: 1. Pemphigus vulgaris, the most common type, affecting skin and mucous membranes. 2. Pemphigus foliaceus, a milder form affecting only the skin without mucous membrane involvement. 3. Paraneoplastic pemphigus, associated with meningitis, particularly lymphomas. 4. Drug-induced pemphigus, targeted by medication such as penicillamine or captopril. Causes: 1. Autoimmune mechanism. Autoantibodies targeting desmoglein 1 and 3 disrupt cellular adhesion. 2. Genetic predisposition associated with certain HLA alleles. 3. Environmental factors, UV radiation or chemical exposure. 4. Medications, drug like penicillamine, rifampicin and captopril. 5. Infections, viral or bacterial infections as potential triggers. Risk factors: 1. Genetic factors, family history of autoimmune diseases. 2. Ethnicity, higher prevalence in Ashkenazi Jewish and Mediterranean populations. 3. Age, most common in individuals age 40 to 60. 4. Gender, slight female predominance. 5. Stress or trauma, physical or psychological stress may trigger episodes. Complications: 1. Secondary bacterial or fungal infections. 2. Sepsis due to widespread skin breakdown. 3. Malnutrition due to painful oral lessons affecting eating. 4. Long-term corticosteroid therapy. Complications such as osteoporosis or diabetes. 5. Psychological issues like depression or anxiety due to chronic illness. Pathophysiology: autoantibodies against dysmorglin proteins lead to the breakdown of dysmosomes. This causes acantholysis, loss of keratinocyte adhesion, result in intraepithelial blister formation. Over time, the skin becomes fragile and prone to erosions. Mucous membrane involvement is common in Pemphigus vulgaris due to dysmorglin 3 expression. Pathophysiology of Pemphigus vulgaris, step-by-step process. 1. Genetic predisposition and environmental triggers. 2. Autoimmune activation. 3. Formation of autoantibodies. 4. Disruption of dysmosomes. 5. Blister formation. 6. Erosion and ulceration. 7. Inflammatory response. 8. Impairment of skin barrier function. 9. Chronic disease progression. 10. Systemic effects and complications. By understanding this step-by-step progression, healthcare providers can intervene early to heal a disease progression and improve outcomes. Signs and symptoms. 1. Mucosal lesion, painful erosion in the mouth, throat or genitals. 2. Skin blisters, flaccid, easily ruptured blisters leading to painful erosions. 3. Nikolsky sign, skin sharing, of slight pressure. 4. Pruritus, mild to severe itching. 5. General symptoms, fatigue, malaise, and pain. Diagnosis: 1. Clinical examination, presence of mucocutaneous blisters and positive necrologic sign. 2. Histopathology, biopsy showing interepithelial acantholysis. 3. Direct immunofluorescence DIF, deposition of IgG and C3 in intercellular spaces. 4. Enzyme linked immunosorbent assay ELISA, detection of dysmogulin auto antibodies. 5. Blood test, elevated inflammatory markers and autoantibodies. Nursing diagnosis: 1. Impaired skin integrity related to blistering and erosions. 2. Acute pain related to mucocutaneous lesions. 3. Risk for infection related to open wounds. 4. Imbalanced nutrition, less than body requirements due to painful oral lessons. 5. Anxiety related to chronic illness and altered body image. Management: medical management. 1. Corticosteroids, high dose systemic steroids for acute disease control. 2. Immunosuppressants, azithromycin, mycophenolate mofetil or cyclophosphamide. 3. Biologics, rituximab targeting B cells. 4. Antibodies or antifungals for secondary infections. 5. 4. Immunoglobulin to neutralize pathogenic antibodies. Nursing management: 1. Wound care, gentle cleansing and application of dressings. 2. Infection prevention, maintaining hygiene and aseptic techniques. 3. Pain management, administering analgesics as prescribed. 4. Nutritional support, encouraging soft, high protein diets. 5. Psychosocial support, counseling to address emotional distress. Treatment options: 1. Systemic therapy, corticosteroids and immunosuppressants. 2. Plasma pheresis, removal of pathogenic antibodies. 3. Topical therapy, steroid creams for localized lesions. 4. Phototherapy, ultraviolet light in selected cases. 5. Emerging therapies, JAK inhibitors and other targeted agents. Psychosocial medicine. 1. Emotional support to address feelings of isolation or depression. 2. Support groups for patients and families. 3. Education on coping strategies and disease management. Prevention. 1. Avoiding known triggers such as specific medications to prompt treatment of infections. 3. Regular follow-ups for early detection and relapses. Conclusion. Pemphigus vulgaris is a debilitating autoimmune disease that significantly affects patients' quality of life. Early diagnosis, aggressive treatment, and a multidisciplinary approach are essential to manage symptoms and prevent complications. Continuous research and advancements in treatment options offer hope for improved outcomes. Thank you. Have a nice day.